Vamshi Krishna. So in this video we will see some of the basic questions. So the first question is maximum score of many mental status examination. Options are 15, 11, 30, 55. The right one is option C, 30. Okay, so C is a 30. So we have the mini mental status examination has 30 score. So we will see what are all the components will come under the mini mental status examination. So the first one is the orientation. So in this orientation, we need to ask about the year, month, day, and a casual things we can ask to the person and registration. So examiner has to take the three objects, for example, apple, pen, and table. So simple things they will ask the registration component, and the next they will check for the attention. So in this attention, how the person is attentive. Okay, for example, if the examiner asks the serials of number, so if the person is giving the a correct answer means he will get the 5 score. So like that we have the a complete score is the 30. So mainly we have the orientation, registration, attention, recall, language, and copying. So these are the capabilities we can see by using mini mental status examination. So the next question is, in which condition the children is pulling heads? Okay, for example, when we are studying seriously, unknowingly we will take out the hairs from our head. Okay, this is normal for some people, but in psychiatric, mental ill patients, that is nothing but the children who are suffering with some kind of depression and stress, they are continuously pulling the hairs from the head. So this condition is known as, options are phobia, depression, trichotillomania, and all of the above. Trichotillomania. So the right one is option C. Trichotillomania is a condition known as pulling of the hairs from the head. So the next one is a confirmatory diagnostic test for multiple pregnancy. So the options are ultrasound, X-ray, physical examination, CT scan. So which one is a confirmatory diagnostic test for the multiple pregnancy? So the multiple pregnancy is nothing but the mother is having the babies more than one. Okay, it may be 2, 3, 4. Okay, in recent news we got that a mother is delivered 5 babies. So it is known as a multiple pregnancy. So how we can diagnose it? By the ultrasound. Okay, ultrasound scanning we can go for the a confirmatory diagnostic for the multiple pregnancy. So x-ray is contraindicated in pregnancy. So physical examination, by the physical examination we cannot identify the how many babies are present in the womb. So CT scan is not that much required. Better one is a ultrasound. The next question is, breast milk can be stored at room temperature. Okay, for how many hours, otherwise how many days we can store breast milk at room temperature? Options are 2 hours, 3 hours, 4 hours, 8 hours. The right one is option C, 4 hours. So up to 4 hours we can store the breast milk. But in the case of fridge, so we can keep the breast milk for up to nearly 4 days. Okay, in the refrigerator. The next one is, which of the following is the best indicator for long-term nutritional status in 15 years old child? Options are MUSAC, height for age, weight for age, weight for height. The right one is option B. Height for age E will give the a long-term nutritional status. Okay, MUAC is nothing but mid upper arm circumference. The next one is cerebral malaria is caused by. Options are Plasmodium vivax, Plasmodium falciparum, Plasmodium malariae, Plasmodium ovale. The right one is option B, Plasmodium falciparum. So, this infection can spread to the brain. Okay, so this condition is known as cerebral malaria. The next one is bilobed nucleus is observed in. So in the picture you can see this is a type of blood cell. So we have the nucleus bilobed. Bilobed is nothing but two lobes. So this name is known as, options are neutrophils, eosinophils, erythrocytes, lymphocytes. The right one is option B, eosinophils. So eosinophils has the bilobed nucleus. Next question is, decrease in the concentration of potassium is known as, is called as. That is nothing but decreasing of potassium in the blood. Options are hyponatremia, hypokalemia, hypovolemia, none of the above. The right one is option B, hypokalemia. Kalemia is nothing but K, potassium, and natrium is a sodium. Hypovolemia is nothing but decreasing of fluid in the body. None of these is nothing but nothing. The next question is, formation of blood cells is known as. Options are hemolysis, hemostasis, hemopoiesis, hemodynamics. The right one is option C, hemopoiesis. Hemopoiesis is nothing but erythropoiesis. Okay, it is also known as erythropoiesis. That is production of red blood cells. Okay, so where it will going to happen? Production of red blood cells in the bone marrow. So hemodynamics are nothing but changes in the circulatory system. Hemostasis is nothing but stopping of the blood leakage, otherwise hemorrhage. And hemolysis is the lysis. Lysis is nothing but death. Okay, death of the RBC. So the next one is, the cartilage at which trachea is divided into bronchi is known as. So we have the trachea here, okay, and these are the lungs, and here we have the right lung. So the right lung consists of three lobes, left lung consists of two lobes because the heart is located here. So we have the C-shaped rings over the trachea. It is about 15 to 20 C-shaped rings we can see in trachea. So the question is, the cartilage at which trachea is divided into bronchi. So here we have the cartilage where the trachea is divided into bronchi. So this cartilage is known as, options are hyoid, cricoid, corneae, carina. The right one is option B, cricoid bone. So this bone is known as the cricoid bone. Okay, this is not Kareena Kapoor. This is Karina. So the next question is, causative organism for smallpox. Options are paramyxovirus, variola virus, treponema pallidum, clostridium tetani. The right one is option B, variola virus. So variola virus is caused for the smallpox. So the next question is, the thick filament of skeletal muscle contains. Options are actin, troponin, tropomyosin. The right one is option A, myosin. So myosin filament has thick layer, okay, but actin has the thin layer. So in the picture you can see, so this is a cell of the skeleton muscle. So here we have the sarcoplasmic reticulum, okay, covering layer of the cell, and we have the myosin filament over here, okay, and in between we have the a kind of design. So this has the thin filament, that is actin filament. So this is a tissue of the muscle, and this is a cell, okay, myofibril. So tissue is covered by the muscle fiber, and it has the nucleus and bands, dark I band and A bands. So here we have the, so each fiber has the thin filament, thick filament, and a sarcomere. So all the structures we can see in the each myofibril cell. The next one is, if first day of menstruation is considered as first day of new reproductive cycle, on which day does ovulation occur? Options are option A, day 5, option B, day 9, option C, day 14, option D, day 23. Most of the people know about this. The right one is option C, day 14. So this is a danger period. Be careful. Okay. So this is a 14th day is ovulation will taking place. The next one is most unreliable birth control method with maximum failure rate is. Options are vasectomy, pills, condoms, coitus interruptus. The right one is option D. Coitus interruptus is nothing but during the intercourse, okay, during the intercourse, when the ejaculation is going to happen, the man is removing the penis from the vagina. This is called coitus interruptus. So vasectomy is nothing but cutting of the vas deferens, and pills are the medications, condoms are the barrier methods. So the right one is option D, coitus interruptus. The next one is a blind spot in eye is a synonym for. Options are sclera, cricoid, coracoid, optic disc, macula lutea. The different name is macula lutea. The right one is option C. Optic disc is known as blind spot of the eye. The next one is a stimulation of sympathetic nervous system causes. Options are increased sweating, increased bile secretion, increased GI secretion, airway constriction. The right one is option A, increased sweating. So increased sweating we can see, or it is conducted by or controlled by the sympathetic nervous system. The next one is, which of the following is not a symptom of diabetes mellitus? Options are insomnia, polyphagia, polydipsia, polyuria. The right one is option A. Insomnia will not present in diabetes mellitus, but they will have the polyphagia, polydipsia, and polyuria. The next one is the vagus nerve is also known as of cranial nerve. Options are 8th, ninth, 10th, and 11th. The right one is option C. Option C is the 10th cranial nerve is the vagus. So we will see the cranial nerves over here. So first one is the olfactory, second is optic, oculomotor, trochlear, trigeminal, absence, facial, vestibulocochlear, glossopharyngeal, vagus. Vagus is the 10th number, accessory and hypoglossal. So these are the cranial nerves of 12. The next one is vagotomy is a surgical treatment for. So by the name itself you can understand. Options are it is a nerve disorder, it is regurgitation, peptic ulcer, hepatitis. For which condition this vagotomy is a treatment? The right one is option C, peptic ulcer. So vagotomy is nothing but it is a procedure of the cutting of vagus nerve branches. Okay, so vagus nerve branches which is cutting, okay, otherwise removing small parts of the vagus nerve, so which will prevent the decreasing of secretion of HCl in the stomach. So it leads to the we can reduce the cause for the peptic ulcer. So what is the reason of peptic ulcer formation? Mainly for the excessive secretion of HCl. HCl is nothing but it is an acid. So vagotomy is a surgical treatment for the peptic ulcer. The next one is what is the drug of choice in eclampsia? Options are oral magnesium sulfate, intravenous magnesium sulfate, oral phenytoin sodium, IV phenytoin sodium. The right one is option B, intravenous magnesium sulfate. Why? Because eclampsia is nothing but occurring of the seizures, okay, that is epilepsy, okay, seizures or epilepsy, so whatever it may be, occurring of the seizures after the delivery. So immediate after delivery, if the mother is having eclampsia, we cannot go for the oral magnesium sulfate tablets, okay, so we need to go for intravenous magnesium sulfate infusion, so we can prevent the eclampsia. Eclampsia is nothing but increasing of the blood pressure. So it leads to the seizures. The next one is which hormone is responsible for hyperemesis gravidarum? Hyperemesis gravidarum is nothing but excessive vomiting and nausea. Options are progesterone, relaxin, HCG, human placental lactogen. The right one is option C, HCG. So this hormone is responsible or the cause for the hyperemesis gravidarum. So this is end of my class, guys. Thank you for watching.